One of the commonest causes of infertility in ladies is blocked tubes. So in today's lecture, let's discuss what causes it, and in case it happens, what you can do to help you get a baby. Now first, let me give you some context. The fallopian tubes are also called the oviducts. They will connect the woman's uterus to her ovaries, and they will create a pathway for the sperms and the eggs to move. In fact, fertilization always occurs inside the fallopian tubes, after which the embryo will move now to the uterus, implant, and start growing. On their own, these fallopian tubes are just simple hollow tubes, but inside them you'll find millions of small hairs. We call them cilia, almost similar to the hairs that you have in your nose. Now these cilia or hairs are beating back and forth, back and forth. This beating movement will have two functions. The first one, it allows the egg to move inside the fallopian tubes. Then secondly, it clears the fallopian tube of any water that attempts to collect inside there. Now let's get to the causes. So the commonest cause of blocked tubes, that's around 70 to 80% of cases, is an infection we call PID, or pelvic inflammatory disease. Now this is a bacterial infection predominantly caused by one of the two bacteria, either the one that causes gonorrhea, we call it Neisseria gonorrhoeae, or the one that causes chlamydia, Chlamydia trachomatis. Now these are sexually transmitted infections. After someone has had this infectious intercourse, this bacteria will migrate from the vagina up into the uterus, up to the fallopian tubes, and they will start causing these infections. After this infection has seeded very well inside the tubes, you'll have massive inflammation occurring. This will lead to two things. One, you'll have a lot of scar tissue forming inside the tubes, and then secondly, the cilia, the hair we've talked about, they will stop beating. Now, blockage will occur either from water collecting inside the tubes, what we call hydrosalpinx, or you'll find the scar tissue physically blocking the tubes. Other causes of blocked tubes that are not pelvic infections, you can have adhesions following a pelvic surgery. So someone can have a cesarean section, someone can have a surgery to remove the fibroids, or even a surgery to remove an appendix. After that, when that tissue is healing, it can heal with these bands we call adhesions, and they can attach themselves to the tubes and cause physical blockage. Then you can have endometriosis, whereby that tissue from the endometrium can move back into the tubes and cause irritation there, though this tends to take months to years. So how do we know someone has blocked tubes? Now usually the very first sign will be failure to conceive or to get pregnant after 1 year of trying, even though someone has had very regular periods and are not using any family planning. In fact, 40% of all cases of infertility in ladies, it's due to blocked tubes. Then if some ladies will come reporting pain in their sides, on both sides, what we call the inguinal area in medical language, but in local language they call it mondira. So a patient will come and say, Doctor, ninobulumi mondira. Usually it is a sign of inflammation in the tubes or in the pelvis from those pelvic inflammatory disease infections. Then I like to do this chlamydia antibody test. Usually it will stay positive even after 6 months of the infection. So it can show us if someone ever had this infection and maybe it left that damage that might have caused the blocked tubes. Then if you are to do an ultrasound scan, it might show hydrosalpinx when you're having water within your tubes, or it might show water in the pouch of Douglas, somewhere behind your uterus there. In case you're having this pelvic inflammatory disease infection, water tends to collect in that pouch of Douglas. So then lastly, if we are to do the HSG test, hysterosalpingogram, whether we push dye into the uterus and into the tubes, and it should pour out into the pelvis next to the ovary. So in case we're having blocked tubes, that dye will show a blockage at some point, and we can know that these tubes are blocked. Lastly, let's discuss treatment. Now, the very first thing is giving you antibiotics in case we find you with pelvic inflammatory disease. This is very important. Then the second thing is tubal flushing using a cannula. This one we do it during the HSG test. So in case we find that the tubes have been blocked, they shall try and flush them out with the cannula and some small fluid. In fact, this is the reason why sometimes people say that HSG test is very painful. We just be trying to unblock your tubes. Then number 3 is surgery. Now this one in most cases will be laparoscopic surgery, meaning we shall create small holes on your abdomen, then we shall introduce a camera and surgical instruments, and that's how we shall operate. So in case you are having adhesions from a previous surgery, like a scissor, we shall undo those adhesion bands and we shall undo the blockage. Then in case you are having a blockage of the tubes but it's very close to the ovary side, we shall create a small hole in the middle. This will be the new opening. We call this a salpingostomy, though this one will kind of increase your chances of getting an ectopic pregnancy, so we have to be vigilant. Then in case someone has hydrosalpinx and it is severe, so much water in the tube, and it seems the tube will not work. If this person is to go for IVF, we have to remove that tube. We call this salpingectomy.